Hi, good day everyone. My name is Katyana Azman and I am a consultant child psychologist based currently out of Pantai Hospital, Kuala Lumpur. And the team at Naluri have so kindly invited me to speak today on a topic which I think is really relevant not just to parents, but also those who are working with children, given the situation that we've just come out of with the COVID-19 pandemic. So the title of the webinar today will be called Supporting Children with Mental Health and Behavioural Challenges at School. So we'll be looking at some of the more common conditions that we see happening that impact upon learning and mood within a school setting. But again, if it's hopefully going to be relevant not just to teachers who are wanting to support their kids in a classroom, but also to mom and dads who might need a little bit of extra advice on how to navigate these challenges at home. What are the key things to look for, as well as what to do if you identify these challenges. So with that, we'll kind of just jump right into it. A lot of people do tend to ask, why is it that what we call mental health issues or learning issues are something that kids don't just grow out of and something that we have to address, especially when they're in school. I think within the context of Asia, there is definitely a lot of concern over the stigma of diagnosing a child who might have some learning or mood difficulties in a school setting. And so I find a lot of parents do express a lot of concerns over why this has to be something they need to look into. And primarily the reason is because children who do have these challenges will find it difficult, not just emotionally, but definitely on an academic as well as a social front. It's something that has the capacity to really impact their development in these areas. And so for that reason, we kind of want to make sure that we're addressing it as early as possible so that any form of intervention that we can offer children is something that we can actually get done as quickly as possible so their prognosis is a lot better. This was a quote that was said by the regional director of WHO Southeast Asia a couple of years ago, which kind of addressed why it is it's so important to identify and support young people with mental health in all of these different areas. So just a little bit of statistics, not to bore anyone, but worldwide, 10 to 20% of children and adolescents experience some type of mental disorders. Now, this includes learning difficulties as well. Unfortunately, it falls under the same umbrella. Overall, in Malaysia, the prevalence rate is 12.1%, a number which we within the community do find a little bit subjective because, of course, these statistics are gathered with voluntary information. And so, again, given the stigma, we do believe that this number is higher than what's reported on your screen. So 12 to 1% of children between the ages of 5 to 15 years meet the criteria for a mental health condition, according to the DSM-5. Now, half of all mental illnesses begin by the age of 14. Now, this is when looking at adults later on in life who were diagnosed with mental health conditions. When they reflected upon their journey with their struggles, half of these individuals were able to identify symptoms or criteria which were present by the age of 14. 3/4 of these symptoms were present by their mid-20s. So definitely the belief that mental illnesses or mental health challenges manifest in adulthood, or something that I hear quite commonly in my practice, that they're all grown-up problems. So what do kids have to be stressed out about or have depression or anxiety about is completely a myth. Neuropsychiatric conditions, so things like anxiety, depression, even learning difficulties, are the leading cause of disability for young people around the globe. These are some of the more common conditions that we see in an academic setting. So definitely learning challenges. These are for the teachers out there. You would probably be very familiar with these things. For moms and dads, you would have had your children be referred to a specialist for an assessment because they are struggling to meet academic milestones. So if it impacts upon a child's ability to learn and study and function in a school setting, we call them learning difficulties. And the more common would be things such as ADHD or attention deficit hyperactivity disorder, things like dyslexia and dyscalculia, which is difficulties with reading, writing, mathematics, things like that. There are also speech and language delays, which impact upon a child's ability to communicate and socialize with those around them. And then developmental delays, so things such as autism spectrum disorder, for example, which is a little bit more pervasive. We also see challenges involving bullying, something that has grown exponentially, in my opinion, since the pandemic began, especially when we look at things such as cyberbullying. So that is definitely something that is impacting children of this generation more than ever before. We're also seeing issues happening within the family dynamic become, I guess, more intrusive, given the fact that kids are spending a much larger amount of time now at home with mom and dad versus prior to the lockdowns. So things such as parental separation, issues within the family dynamic, and divorce. So that's going to have an impact on a child's mental health. And then we have mood disorders, more commonly things such as depression and anxiety. Now, of course, this list is not exhaustive, and there are a lot more other conditions that a clinician such as myself would want to assess for, but these are the ones that often happen within an academic setting that cause some red flags or for teachers and caregivers to notice first. So how do we look for potential challenges? Short of me sitting here and giving you the entire list of criteria that we use in our DSM-5, which is the guidebook that all clinicians use around the world, this is a question I get asked a lot by parents. How do I know that my child is struggling? Very simply, look for change. Now that might seem very, very vague, but I find it to be a very powerful and very simple criteria that any caregiver, be it parent or teacher or grandparent, can use when trying to assess whether a child is going through something that requires further attention. Now, when looking at the concept of change or looking at the topic of change, the first thing we ask is this a change that is environmental or internal? So are there environmental factors or internal factors that could explain why these changes have taken place? And an example of an environmental factor might be mom and dad going through a divorce, the pandemic. So these are factors that are happening in the child's surroundings, which might impact why this change, or which might explain why this change is taking place. Are there also internal changes? For example, has the child been ill recently? So has there been biological changes? Has the child recently gotten their period, right? So there are all these biological or physiological or what I call internal changes that could happen to a child throughout their lifespan. And so when you observe this change, ask yourself, is there an environmental or an internal factor or stressor which could explain why these changes have taken place? The next question you have to ask is whether or not this change is something that has been quite sudden or gradual. The rule when it comes to mental health challenges or learning difficulties is that it is often, if not always, something that happens very gradually. So a child, for example, would not suddenly have symptoms of ADHD or suddenly struggle to read when it was something they were able to do before. If it is indeed due to an underlying mental health issue or an underlying learning or developmental issue, this would not be something they can suddenly manifest. So if it is something that has happened kind of overnight and happened really, really suddenly, chances are there has been a trigger in the child's environment, going back to the first point, which would have caused the change. But if it is something that you have noticed kind of in very, very small amounts from when the child was very, very young and kind of progressively got worse, so it's quite gradual in fashion, then it is likely that we're dealing with an underlying disorder that might need to get assessed. Next, the change needs to be something that is severe enough to impact upon a child's functioning. So things can happen to us all the time, but most of the time we're able to kind of adapt and move forward, and it doesn't impact our ability to function and do the things we need to do day to day. Same applies to children. But if a problem, no matter how trivial, is something that is impacting upon a child's ability to learn and play and socialize and interact with the world around them, then it's definitely something that needs to get looked into. And the final criteria is the change has to be something that is pervasive enough to be observable in multiple settings. So you would have multiple people in the child's environment. So we're talking teachers, friends, cousins, neighbors, all these different environments that the child interacts with, seeing the child in the same way. So you would not be having a situation where the school is saying that the child is unable to function or unable to learn or unable to interact, but the child is extremely sociable outside of school, devours books by the time when they're at home. So you would not be seeing a different representation or presentation of the child in a different setting. If it is pervasive enough, meaning that you see it everywhere, then chances are it is a disorder that needs to be it needs to be diagnosed. But if it's something that is very, very problematic in one environment and one environment only, it goes back to the theory that it might be environmental. So I get that a lot of this might be a lot to process, but this is just to give a lot of you the idea of how change is assessed. But of course, if you feel that this is way too much information, you're welcome to go and see a professional and they can help you with all these questions. But look for change. Don't get too fixated on all the criteria or symptoms that you get off the internet. Any type of change is something that's worth looking into. So say you've identified the change, it's something that's happening everywhere, it's pretty gradual, there's all these red flags going off. What do you do then? Ideally, the gold standard is to have your child assessed, or more commonly described as diagnosed. I like to say assessed because I think diagnosed seems to have a little bit of a negative tinge to it. So have your child evaluated or assessed would be the next best step. Why is this so important? Diagnoses or assessments or evaluations are something that allows clinicians to formulate a plan. So we understand what is affecting your child, how does it affect their daily lives, and what can we do about it, which I personally feel is the main question. Diagnoses or labels don't tell me at all very much about what the child's struggles are. So I like to kind of understand how this disorder impacts their day-to-day life so I can provide the best standard of care for the child themselves. And this includes learning for schools as well. So formulating a plan of attack or plan of action is so important, and that can only come after an assessment. There are screening tools that are available. Some of them are available online, which is something that a lot of teachers do use already in schools. These are all, again, screeners. They are not meant to be used in a diagnostic capacity, but it allows teachers and family members, whoever who wants to use them, to identify whether the child is presenting with an increased risk of a particular condition versus another child of the same age. So if you are a little bit curious, you are welcome to look up these screening tools online. There are also tools which are purchasable through licensed distributors and test developers, such as Pearson and Wiley, which are based in the US and the UK. And those are the types of tools that we use. These purchasable tools do require some level of training or some level of qualification. And so because of that, it might not be accessible to a lot of people. But definitely if you have those qualifications, it's a lot more of a robust assessment measure that you could use. So that is something that we often use in session. And something that we tell parents, if you have the ability to access them, you're welcome to have a look and to run them, and then we can help decipher the information for you. These formal evaluations should be carried out by psychologists, psychiatrists, or developmental specialists. Reason being is because of the level of training and expertise that goes into it. Pediatricians and medical practitioners are a common conduit. So if you do have reservations or don't know where to start with regards to finding a mental health practitioner or a developmental specialist, you can go to your GP, go to your pediatrician, go to your family doctor, and they will be able to direct you in the right direction. So the take home here is to ensure that the assessments are carried out by people in the medical or allied health profession, or at the very least in the therapeutic industry, because they would have the expertise to give you the right information. So say you've done all that, diagnosis has been reached, information has been gathered. What comes next? What are you supposed to do? So I have divided this into two sections, something that I call short-term strategies and later on a long-term strategy section. Now, why I did this is because I think that whenever we talk about strategies, it often looks at how do you prevent problems or struggles from escalating, from getting worse? How do we remedy things, if you wanted to use that term? But we don't often focus on how do we solve or at least diffuse situations in the moment. So I felt it necessary to kind of have this little section here, so at least you kind of know that this is what is advisable, at least in my perspective, of what you should be doing when things take place. And then the long-term strategies are about how to prevent it from getting worse and at least remedying it in in the future. So the first piece of advice I give to parents and teachers is to try to diffuse these episodes. Now, when I say episodes, it could be meltdowns, it could be sensory overloads, it could be just crying and screaming and anger, any type of challenging episode that the child is displaying because something has triggered them. The first thing that I tell people to do is to remove the child from the triggering environment. So if an episode has taken place in the classroom or on the playground, try your absolute best while keeping the child safe to remove them from the environment, because chances are calming someone down in a space where they have just been upset is a lot harder to do. Provide the child with a safe and calm space away from the source of distress. So say they've just been, teased by a bunch of their peers on the playground and it's caused them to get very, very upset. The absolute last thing you want to do is to be keeping them in that space, trying to tell them to calm down while those other children are still within earshot. So I would say bring the child to a calmer space where the source of their distress is as far away as possible and try to help them calm themselves. Explain that you are there to help make them feel better. So try really, really hard not to engage in any dismissive language which tells them, oh, it's no big deal, just calm down. How many of us have actually calmed down when people tell us to calm down? I've always found that very interesting. So it's so important to tell kids, look, I know you're upset and it's really, really unfortunate that this thing happened and I really want to help make you feel better. So how can I help? Just trying to explain to kids that you are there to try to improve on their situation is something that can also be really, really helpful. The next step is to discover what they need. We as adults tend to have this very nasty habit where we try to tell kids what they should be doing based on our own preferences or based on our own experience. 9 times out of 10, it doesn't work very well. So my advice is to try to understand, what does the child need in this situation? They do need to feel secure in your presence as a supportive force. So they need to be able to be reassured that you are there to help them, right? So statements like what I've given here as an example, I can see that you are fill in blank. I can see that you are angry. I can see that you're sad. I can see that you're scared, and I want to help make you feel better. Can you show me how, or can you tell me how I can do that, right? So this allows them to see that you're there to help rather than tell them what to do, and that can be really, really helpful for them. And so after you've been able to ascertain what it is that they need, then do that. But say, for example, the child is extremely upset or says, I don't know, which is also very common. You can also append the following example where you can say, so I really want to help make you feel better. So I'm going to give you a couple of options for you to choose from. And whatever you pick, that's what we'll do. So come up with a couple of things. I say no more than 3 very, very simple things that you can do very readily. And then the child can then focus on these 3 things rather than the overwhelming sense of emotion that they're feeling. So you could say, for example, we could go into the library and just kind of sit for a little bit and grab a book, or we can go to the cafeteria and get something to drink, or we can go back outside and hang out by the monkey bars. What do you want to do, right? So 3 very simple things. I don't like to go more than 3 because that tends to overload them a little bit, but come up with some very simple solutions that you can do. Mind you, they are not going to solve the problem or the trigger that the child has experienced. It's more just to help calm them down, and then do whatever they ask of you, right? Triggers might not be observables. They might not be things that you can very easily put your finger on. And more often, especially with younger children, you will notice that the triggers probably don't make any sense to you because they might seem quite trivial in comparison to what we adults consider problems. And the goal is, or the take home is that you really doesn't need to, right? Because at the end of the day, the whole point of this is to help the child overcome a struggle. And so we need to kind of do it their way and at their pace rather than kind of inserting what we would do, because they lack the life experience to be able to resonate with whatever suggestion you're giving them anyway. So figure out what they need and do your best to follow through. Do so without judgment. Within reason, you need to be able to act on a child's request. I say within reason because they might request something that is completely unreasonable and completely not doable. So within reason, try to act on their request, reinforcing that you're doing so in an effort to help them. It's like, okay, because you're really, really sad and I don't like seeing you sad and I want you to feel better, you want to go for the cafeteria and get a drink. So that's what we're going to do, okay? So kind of reinforcing that you're acting on their request because you want them to feel better. Once a child has calmed and regained their composure, encourage them to try to discuss what happened. So, earlier when I saw you on the playground and you were really upset, do you remember what triggered you? Do you remember what made you so unhappy? Try to get them to talk about what happened so they can connect the dots. I wrote this in capitals. Do not judge, do not punish, and do not chastise. These are all things that are not going to help you moving forward. And in fact, when we look at long-term strategies next, you will see that this is something that actually damages upon the child's rapport with you, which is so important. And so if you're the kind of person who tends to lean towards telling people or telling children that they should or should not do things, that this is something so small, why were you so upset, getting sort of very judgy, and it's very easy to do with kids because a lot of their problems, like I mentioned earlier, can appear kind of small in comparison to what you deal with day to day. But remember, this is their first time going through life and their first time going through probably whatever it is that they're experiencing. So you need to make sure that you maintain your composure and not judge, not punish, or chastise. An example of how I would say something along these lines would be, you were clearly very, very fill in blank. You were clearly very sad earlier, and I'm really sorry that you felt that way. Unfortunately, it's not behavior that's acceptable. We can't keep doing that. So maybe we can figure out a more appropriate or an easier way for you to deal with it next time, and we can do that together. So we can show the child that while we acknowledge the emotion that they were feeling, that emotion is not something that is effective, nor is it acceptable. So we want them to try to be constructive next time moving forward. So it's a learning moment in a way, but not something you can really act on in that situation when they're upset. So the goal is to teach kids tools on how to respond to the behavior moving forward. We are not invalidating the emotion that they feel, which is extremely important. We are just identifying to them that while we recognize and we respect how you feel, that behavior is not acceptable. And so we are going to together find a solution for something else we can do. Not a teaching moment was my comment at the bottom, because kids are not going to be able to necessarily learn the moral of the story in that situation. That's why short-term strategies are all about helping to keep kids calm or helping them calm whilst being mindful of it being constructive in the future. But don't be too surprised if you have to do this multiple times because they might not get it in that first instance. So not a teaching moment. Which brings us to the next part of my suggestions, which I call long-term strategies. Again, this is so that we can help children come up with different solutions moving forward. It's to help diffuse the severity of things moving forward. So this is something that we can look at it in the long-term way. Back to rapport. Trust is a major component of any therapeutic or supportive relationship, regardless of how old the participants are. You need to be able to trust the other person who is in a position to help you. With kids, it is extremely important because there is that component of fear that comes out because they're afraid that if they are too forthcoming or too honest, they're going to get into trouble. And this is probably because they've been met with some type of judgment or repercussion in the past. So it helps to build rapport by kind of so specifically, it helps with the relationship by ensuring that the rapport building process takes place. So the sooner they trust you, the sooner they feel comfortable with you, the easier things moving forward will be. Younger children are more receptive to play-based approaches just because of how their brain is developed or how their brain is developing at that stage. They might not be as verbal or as expressive in being able to connect those dots I talked about a little bit earlier on why they feel a certain way. And so something play-based, so something involving art and toys and their favorite, games and things like that are stuff that are probably going to allow them to open up a lot faster. So I often like to start with play-based approaches with young children versus sitting them down and telling them or expecting them to tell you their whole life story. Older children will respond to more relaxed conversations. So don't bring out the toys and the art if you're dealing with a teenager. They'll probably just think that you're being condescending, but definitely something to try with younger kids. With older kids, just being very, very relaxed, not kind of having any furniture like desks in between you when you want to have a chat. Sit on a couple of couches, grab a couple of bean bags, make it very relaxed. Allow them to see that you are very open and, again, not judgmental. Allow them to ask questions about yourself or allow them to ask questions about your experience. Be open and allow them to kind of get that information out of you so they can see that while you aren't, that because you aren't kind of putting yourself behind a wall, they don't need to do that either. So building rapport is something that is extremely integral when dealing with young people. And this might not be something that happens overnight. I have some clients that I'm able to build a pretty good rapport with rather immediately. And I've had some clients that take months in order to get there. So it really is a subjective process, and you kind of have to be patient and kind of let that take place. The next thing that I like to recommend is something which I call reframing. Due to the level of their neurological maturity, and just something that's not written on the slides, the part of the human brain that actually allows kids to look at things the same way that we do as adults, and I don't just mean in an actual visual way, but rather more just how they process things, is all controlled in one region of the brain that only develops fully when an individual reaches about 28, 29, 30. And so when we're dealing with young children, this part of the brain is still doing a lot of growing and is extremely immature. So that's why you will find even teenagers struggling to look at things from their parents or from adults' perspective. Because of this immaturity, they tend to also be what we call egocentric. So they are mostly kind of focused on their point of view. They find it very difficult to look at things from other people's perspective, or what we call empathy. So they are egotistical and not exactly empathetic. And that's not because they want to be, it's just the way that the brain is at that stage in time. Building upon their ability to appreciate something from a different perspective helps to diminish the severity of something that happens, right? So what I mean by that is having them kind of see the same story or the same scenario from the perspective of a friend or from the perspective of a cartoon character allows them to kind of click with that subject a lot better. And so because of that, something that felt very upsetting when it happened to them might not feel the same way when they're watching it from someone else's shoes. So that's something that's really, really helpful. Encourage a child, what you can do is you can encourage a child to imagine what they would say or do if someone they cared about was in their shoes. So for example, if they felt that, what was an example I heard recently? So say that they felt that kids didn't want to play with them because they were not very good at sport. And because of that, no one wanted to be their friend. And that really impacted upon their confidence and their sort of social behavior. One of the things that I would say is, okay, so imagine that one of your friends, one of your best friends, came up to you and said, I don't think anyone wants to be friends with me because I'm really bad at football, right? If you heard that, would you agree with him? Would you say to him, well, yeah, nobody wants to be friends with someone who's bad at football? Or would you have something else to say? 99.9% of the time, your child will say, well, of course not. I would still want to be your friend even though you're not that good at football, right? Not something they would be able to do for themselves. So it's often helpful because it allows them to see something from a different perspective and, again, make things feel very different when it's in someone else's shoes. Something that their brain will learn how to do one day, just not something they can do naturally yet because of how their brain is developing. The next thing that I tell adults, so I say adults, parents, caregivers, the whole point of all this is that we want to empower our kids. When we tell our kids what to do, when we solve their problems, something which I feel we as adults just can't help ourselves with, what we're doing is that we're eliminating their ability to learn on how to be resilient and how to be constructive and how to solve problems themselves. And so that becomes a struggle as they age and as they get older, constantly needing people to fill in this void. So I think that the main take home is that when we're trying to support these kids, we want to empower them, to give them these tools. People are motivated to change by the presence of self-efficacy or confidence in oneself and the possibility of positive reinforcement, which is some type of reward. So when we feel that we have the ability to fix or overcome or handle a particular struggle, we are more likely to do them. And if it brings us some type of benefit, we are even more likely to do them. So if we can empower our children from a young age on how to manage these situations, the likelihood that they're going to be able to do so without very much support moving forward in life is a lot higher. You want to focus on developing on a child's self-confidence in their abilities, so this self-efficacy concept, to be independent and to make good choices. So remember that just being able to identify look at how you solved that problem. Great job. Showing them that they have that ability is really, really powerful. Use praise, not threats. Sadly, something that we Asian kids did grow up with quite a lot of, threats. But praise is not something that's really going to hurt your kids, contrary to what people say about how it makes kids have a huge inflated ego. But praising your kids for effort, not just outcomes, is also something that is really important. So kids know that there's just as much power in the work you put in rather than the outcome that you get. Consequences are often necessary, but empowerment encourages the maintenance of positive behaviors rather than fear. So it's something that has been really enlightening in the mental health community in the last, I'd say 30 to 50 years, is recognizing that whilst threatening people and instilling a sense of fear does get people doing things they need to do or avoiding things that they shouldn't be doing, ultimately what it does is that it does kind of encourage more helplessness in some cases. So showing people that they can do things, showing people that they have the capability and that they have the ability to be successful is something that allows the maintenance of positive behaviors in a much better way. And I kind of had to put the extra comment there on do not judge, just reiterating how important it is. Kids are extremely receptive to the mood in the room. And so all it takes is for somebody in a person of some type of influence, whether it be a teacher or a parent or a caregiver, or an older sibling, someone who they look up to make them feel very silly for the things they feel or for the struggles that they have. And that's going to be something that's going to stick with them because they've only been on earth for X number of years and they do not have enough of that life experience to rationalize away that one person's opinion of them isn't going to reflect on the whole human race's opinion of them. So making sure that you are mindful of the judgment and the temperament and the tone that you take with kids is extremely important. And with that, that's pretty much the end of my little presentation on how to support kids. I know it kept a lot of it mostly vague, but I wanted to give everyone a really good starting block on what to look for and what to do. And with that, I hope it's given people some ideas on where to start. And thank you so much, everyone, for your attention today. And I hope to hear from everyone sometime soon. Bye.